Good evening. In tonight's health segment, we delve into the latest findings on alcohol and its link to cancer. A new study released today provides a clearer picture of just how many cancer cases and deaths are driven by alcohol consumption.
Researchers from the American Cancer Society and the International Agency for Research on Cancer have found that 40% of all cancer cases in the United States among people aged 30 and up are due to potentially modifiable risk factors. These include cigarette smoking, physical inactivity, consumption of processed meat, viruses, excess body weight, and alcohol consumption. The data, drawn from 2019 to avoid pandemic-related anomalies, was published in the American Cancer Society's journal, CA, a cancer journal for clinicians.
Cigarette smoking remains the leading cause of cancer, responsible for about 19% of cases. Excess body weight follows, accounting for 7.6% of cases, including cancers of the gallbladder, esophagus, liver, and kidneys.
Surprisingly, alcohol ranks third, contributing to 5% of cancer cases in men and women over 30. Public awareness of the link between alcohol and cancer remains low. A 2020 national survey revealed that less than a third of U.S. adults knew alcohol increased cancer risk, and about 10% mistakenly believed that drinking wine reduced their risk.
The study attributes approximately 24,000 cancer deaths and 95,000 cases in a single year to alcohol consumption. Alcohol is linked to 7 types of cancer: oral cavity, pharynx, larynx, colorectum, female breast, squamous cell carcinoma of the esophagus, and hepatocellular carcinoma of the liver.
Lead author Farhad Islami, Senior Scientific Director of Cancer Disparity Research at the American Cancer Society, emphasizes that the increased risk is due to the alcohol itself, not the type of beverage. A standard alcoholic drink in the U.S. contains about 14 grams of pure ethanol, equivalent to a 12-ounce beer, a 5-ounce glass of wine, or 1.5 ounces of liquor. Research indicates that higher alcohol consumption correlates with a higher cancer risk.
Even low levels of alcohol consumption can pose risks. A recent CDC study found that about 17% of cancer deaths were linked to alcohol consumption below the National Dietary Guidelines recommended limits.
Other studies, including those from Canada and earlier U.S. research, have also highlighted the significant impact of alcohol on cancer rates. Experts are particularly concerned about the rising incidence of alcohol-related diseases among women and younger people. Despite a decline in overall cancer mortality, the strong link between alcohol and breast cancer remains alarming, with 44,000 cases, or 16% of female breast cancer cases in 2019, attributed to drinking.
As we continue to understand the health impacts of alcohol, it's crucial to raise awareness and encourage healthier lifestyle choices. Stay tuned for more updates on this important issue. That's all for tonight's health segment. Back to you in the studio.